I've had hundreds of stitches in my face.
I get hit by the puck in the face, and it was really, really bad.
Broken both my orbital bones, broken my nose 12 times.
I took a puck in the face just below my eye here.
My 4 front teeth are fake, shoulder surgery, broken foot, broken hands, broke my arm. I think that's it.
Growing up, I was always playing sports, and I enjoyed it immensely. I rode crew in college, I skied avidly, and when I got the opportunity to get older and become a plastic surgeon and get invited to be a plastic surgeon for a professional sports team, it was like a dream come true.
So through the years, I've been working with the Florida Panthers of the NHL, the Miami Dolphins with the NFL, and then I've worked with UFC fighters and MMA fighters, as well as some other collegiate athletes of different sports.
Hockey as a sport is so enticing and intense. From what I do, being a plastic surgeon, there are so many opportunities for patients to get hurt. Pucks are going at their face at high miles an hour. Sticks are coming their way, elbows, fists. They're getting checked against boards. They're getting thrown to the ice.
It's a tough sport, there's no doubt about it, and we're not doing it for 16 games, we're doing it for 82.
The speed of the game, the emotion of the game. Guys are flying around in between 20 and 30 miles per hour, running into each other.
So my role as a plastic surgeon in hockey, professional hockey, is important. I'm actually the physician that treats them the most frequently in the moment. I suture a player just about every single game. Plastic surgery can get patients back to being their best and allowing them to do things they may not have been able to do without plastic surgery.
I've treated a wide range of injuries in hockey players, including total nasal reconstruction, orbital fractures, which include the floor of the orbit as well as the side of the cheek. There's also mandible fractures, and there's a large array of different types of lacerations on the forehead, nose, in the mouth, and in the chin.
As a plastic surgeon, I have a special skill set. We restore form and function and treat all parts of the body. When I have an athlete that gets hurt, I feel comfortable treating almost any part of the body, knowing that I can put them back with optimal form and make them look better than they did before.
He's a big asset because these guys are getting cut in different areas of their body, whether it's their face, their arms, their legs, by skates and pucks and sticks, and it's his ability to stitch up the area. And my personal opinion, if I'm going to have someone stitch my face, I'd rather have a plastic surgeon than the typical emergency room doctor do it.
You know when you're laying down at a table and somebody's job is to make people look better with medical instruments for a living. You definitely feel better about laying on that table. That's 100% true.
We know that we're in good hands. It's a simple process for us. I mean, when we have good docs, that's just so important to us being better hockey players.
Their number one goal is to be healthy and be functional and also be able to be the best they can be in their sport. So when you're passionate about what you do and you're giving the care to them that they actually want and understand that this could make or break their career and make or break that certain game that they're playing, it's rewarding to see them play and also play at a higher level than they would if they weren't getting the care or the treatment of the medical team that we have.
These kids have a long career in hockey and are susceptible to these things, and with the plastic surgeon they just feel much more comfortable. Plus he does a great job. The plastic surgeon, that's what they're trained to do, so they truly enhance our care of the athlete.
My role with the Florida Panthers is the team dentist. For 25 years since the onset and beginning of the team. And so I've been working with every physician that's been a part of this team. There's much to lack without a plastic surgeon, even on visiting teams, since we take care of both teams that are here, that are playing.
The great thing about treating professional athletes is that there's a bit of pressure and reward at the same time. So they're treated differently than a regular patient, because they have to go back to work at a high level very quickly. And I have a lot of people, the whole team, coaches, general managers, looking at what I'm doing and relying on me to treat them, get it to heal quickly, and then get them back on the ice. And so the problem-solving aspect of treating professional athletes and working with other specialties is amazing.
For us as athletic trainers on the bench, our primary goal is basically to stabilize the athlete, get them to more advanced care. That's where the likes of a guy like Dr. Albert comes into play. Without his services, we couldn't do what we need to do and be as effective as what we need to do.
So on game day, it's all hands-on. It's teamwork. The doctors, we get ready, we set up the suture area so when things happen, and we're watching the game, keeping tabs on what's going on the bench, what's going on the ice, and it takes good communication.
During a game, both Dave and I are on the bench, and we're in constant communication via radio, just with us two. And when we see something happen on the ice, we take the athlete back into our exam room, and then Dr. Albert, that's when he does his suturing, and we try to get them back as fast as possible.
So then if we need x-rays beforehand, if it's a nose or we're concerned there's a jaw fracture, we might take an x-ray first. But obviously we're going to start to control the bleeding first, which is first and foremost. They don't mind a little blemish here and there, but they don't want to be living with a scar.
In the end, we'd have a lot more ugly hockey players, there's no doubt about it.
I was in good hands, and really I wasn't pretty to start with, so it didn't really matter.
I think I look better than I was before because I have a pretty man scar, you know. It's I think it's get me more points with the girls, so even my wife tells it.
So the great thing about plastic surgery is it marries form and function in medicine. And what we have often in hockey is injuries to the face that could be deforming. And the best compliment I've gotten was that a wife said, "He's never looked better. He looks better now than before the injury." The most rewarding part is player gets injured, they're all worried they're going to be out of the game or even for a few games. I suture them up, get them back on the ice, and either they score or we win the game.